Yeah. Okay. So thank you everyone for joining today. Thank you for your time. So Sandra today would demonstrate us for three things. And for each question, each category, she will actually show a few exercises.
Yes.
So just to take note that these exercises are general exercises, meaning if you are 5 years old or you are 75 years old, you can do this. So it's a general exercise. But if you have questions regarding your very specific pain or muscles or backache or stuff like that, then it's a very case-to-case basis. So you are recommended to find a physiotherapist and seek professional consultation. So for today, it's a very general exercise that we all can do. Okay. So right now, I'll just pass the time to Sandra.
Okay. Hi, everyone. Good morning. Happy Sunday. First of all, just want to thank you, Pastor Ban, and also Hillside family for this opportunity that I can share my humble experience to all of you. Hopefully that through this sharing, everyone will just pick up something, okay? Or even, in fact, this session that we're going to be moving a little bit, okay? So just when I describe and demonstrate all this exercise, feel free and please join me, okay? So let's start. Okay, so this, first of all, we're going to talk about correcting bad posture, as we mentioned. Now, before we want to correct a bad posture, we have to understand what are the bad posture out there. Okay, so I'm going to divide this posture, our whole body, into three categories. So we will have our neck, meaning to say our head, and then we will have our upper body, okay, upper body, and all the way down to our lower body, which in relation with our legs. Okay, so first of all, we have to understand why posture. Okay, so whenever you have a pain, when you have a good posture, actually it will help to manage any existing pain that you have, especially those you can relate with the neck pain, the shoulder pain. And then second of all, when you have a good posture, it will definitely make you look good and make people feel, first impression, wow, like this. So if you're hunchback and then if you're slouch posture, then there will be something, it's just a bit of, difficult. Okay, and then other than that, posture actually help you to enhance for your performance, because not only just about sitting or standing, but also about how we move. So it matters. So like some of us who are more active, you exercise like that, then you'll find that certain position you can't really do it. So it relates back to posture. Now my colleague actually has her quote saying that body awareness is the key in movement. So in these questions, I want to target and I want to help you to understand that why having that good awareness of your body posture, it plays a very, very big part in every day of our lives. Okay, so now what are the positions? Like I said just now, we start with the head. So forward head posture is a very common condition that we've seen. So what is forward head? Now imagine your head is like a watermelon. Our head is actually very heavy. It weighs around 5 kg, the weight of it. So it's 12 pounds. So now, how do you develop forward head posture, especially in this work from home season, is that because you try to look to the computer. So imagine in everyday life, you're sitting like this, and then you just look, you try to find out, you try to type your document, you try to zoom in to watch a video. So every inch that you try to move your head forward, it will create that kind of tension over your spine, your bones, and your neck. So like I said just now, your head is like a watermelon and your neck is just a stick. So what happens if when the watermelon moves out of the stick will try so hard, to handle that weight of your head, related like the watermelon. So the more that the head go forward, thrust forward, the watermelon go out of the stick. So can you imagine the kind of tension and the force the stick has to bear? Okay, so if you have a mirror in front of you, or in fact, you can ask your family relatives to help take a photo from your side view. Just go over to the side, okay, look into the mirror and just be in your relaxed posture. Do you have a forward head? So how can you check that? Now, the next picture I'm going to show you, if we were to draw a line, okay, so after you take the photo, you look to the mirror, you draw a line, cutting your body into directly half, okay? So the measurement here will be the ear. Can you see? The ear, if it's thrust forward, instead of stacking on top of the shoulder, the tip of the shoulder, if you can see my arrow here, so means that you have a forward head. Okay, so you can self-check yourself. And then now, what are the exercises to fix this forward head? Usually forward head, our muscles over the front neck here is lengthened and weakened. And then behind is very, very tight because try to hold the watermelon, try to hold your head back into the position. So we got to train the front muscles here. A very, very simple exercises. You can do it now. It's called the chin tuck. Let me demonstrate one time. So from this angle, okay, so let's say your forward head is like this. Okay, everyone can see me clearly. And then I just got to sit straight and then just draw the chin towards your chest. Just squeeze the double chin out and then relax again. Now draw it in again, squeeze the double chin, and then relax. Okay, can we do it together? So just draw the chin in, and then relax. Give it a good hold for 5 seconds. Yes, so do it as frequent, 10 times for 3 sets. So in fact, there is no certain set of protocol, just do it as frequent as you can. You know, work for 1 to 2 hours, stop for a moment, go to the toilet, and you can just perform this. Okay, or even like the right side, the picture here, you can just find a wall behind and then you try to keep your back stick to the wall and push. You realize that your head is not resting at the wall. So you can just try to put your head back, rest on the wall. So this applies for your driving as well. When you drive, you gotta put your head over to the backrest. I am pretty sure most of us, we won't be putting our head resting on the headrest there for sure, but you can practice that even when you are driving. Okay, so now let's move on to the second posture. What are the bad postures out there? We call it a typhotic posture. So as simple as hunchback, you slouch your body. Okay, meaning to say the shoulder is turning in. Okay, and there's a hump over the back. Now, why this is a bad posture? Because following the slide, I want to highlight to all of you, it can cause breathing difficulty. Now, our lungs, lies inside our ribs, and our ribs relate very well with our backbone in this region, the upper body part, which also whenever you have a slouch position. So it can develop a condition called the upper cross syndrome over to the right-hand side. So this is just a diagram that you can see when the muscle imbalances, okay, distribute over the region over here. So how can we correct this out? If you were there, if the online surveys, I actually taught this in the second last stretch, is the chest out, okay, chest out stretch. Now I will demonstrate one time as well. Just sit tall, and then you can interlock your finger behind your back, keeping your backbone straight. Shoulder have to relax down, make sure your chin tucked, and then squeeze the shoulder blade together, draw your hand behind, away from your back. As simple as this. And if you do have major tightness in front, over the chest, that turn your shoulder in, by doing this stretch, it can open up your chest muscles. Okay, so let's do it together. Sit straight. Now, interlock your finger behind and make sure you squeeze the blade first, your shoulder blade. Squeeze behind, opening up your chest, chin tuck, and draw your arms away. Okay, and hold it for a good 15 seconds. Keep breathing and exhale, and then relax. Okay, so all these stretches, you can do it 15 to 20 seconds, repeat it for 3 to 4 times, and practice it daily. And in fact, you practice it morning, afternoon, night, or even you can every hour in between of your work time, okay, or watching the television. So next, we want to talk about this Lodotic posture. This is in relation with back pain. If any one of you have back pain, definitely you have this alteration happening behind your backbone and also the surrounding muscles. Now, we do have a curve over our lower back, but if there is excessive curve, it will put stress over here. That's why you have backache. Okay, next picture is the position. You see this? A good posture is you have a good. Why is a good posture important? Because the alignment is good. The joints over your vertebrae, so-called your backbone, is being distributed evenly. But when you have an alteration, like the another two picture, anterior pelvic tilt, posterior pelvic tilt, it puts the lower back in short lah, summarize it, it puts your lower back, the force distribution is uneven. That's why it will stress on the structure around it. And when there is stress over the structure, it creates pain and discomfort to you. So how can we fix this? Just a small tips, just a very simple exercises, this diagram. So let's do it together. We call it the seated cat and camel. Now, A is the camel one. So you just have to arch your back a lot by sticking your butt behind. Just imagine you stick your butt behind. Okay? And then B, you just round from your back and then do like a hump. Just create a hump over your whole back. And then you can just draw the hand touching the knee. And then you just arch in front again. And then draw back in front. Okay, so this is very important. Basically, it is related with how your pelvis movement. So when you do this exercise, when you move the surrounding muscles, especially covering the lower back, it will give a relief over the tight and tense up muscles. So it's a very, very good exercise that you can just do it, because all you just need is you are sitting in a chair. Okay, so practice this whenever you stretch it out, hold it for 5 seconds, and then you just draw in front, round the bone, round your body down, and then hold it for 5 seconds, and then you just returning. So this alternate movement, just do it for a good 10 times, repetitively for 3 sets as well. Okay, so this is how you can ease out if you have lower back pain. Now next, we're gonna move on. This is a picture of me. So on the left, you can see, what do you see here? I cannot reach the toes, and then my knees are bent, and then you can see that great hump over my upper body. And then just directly a flat, very flat, like straight lower back. And then I got tightness over the leg. So this picture was taken 3 months ago when I have a very, very severe pull over my lower back. And then on the right-hand side, you can see it is me committing to exercises, stretching, like daily stretches, and also definitely go through sessions with my colleague, because we are all physiotherapists. And then eventually, my back pain gone, no longer suffering from back pain, and I have a very good flexibility. I can touch my toes, not very, very good lah, but it's better, okay? My knees are straightened out, and then the hump also lesser. Okay, so this is how, when you move your body, you're committing of doing stretches, it can help you to achieve that kind of result. The differences that you experience is very, very encouraging and very life-changing, I would say. Okay, yeah, so I want to leave all of you in this section of how to correct a bad posture is this. The only good posture is the one that is often changing. Okay, so you gotta move. There is not, because whenever you are in a position for too long, definitely you will feel the sore or discomfort. Just have to move 24/7. Okay, second, how to reduce neck pain and shoulder stiffness. So the less active you are, the tighter things will become. And the more frequently you stretch out, the more flexibility you gain. And you have to understand that tight muscles will always result in injuries. And poor posture can also lead to any health issues, balance problem, and further injuries. So for our body to operate at a peak state, you gotta be flexible. And life is so much easier when your body can move freely without any limitations and restriction. So it's not just about pain-free, but it's being able to do more than that. And consistency is the key. Okay, so this question, we're gonna be moving actively together. So I'll be demonstrating one time, and I will invite all of us to do it together. Now, the first one, neck pain, right? So we gotta learn to move our neck. So neck, the first motion that we have is head turning, just like this, okay? So I want you to sit tall, and then you just look over to the left side with you're just sitting straight up, yeah, facing to the left. And if you can, use your left hand to try to give a push to maximize that stretch over your neck. And then you return back to the center. And then you turn, look to the right, and then Just give a good stretch and return back to the center. Can we do it together? Now sit straight, tall up, look to the left, and then give a stretch, pushing your head, and then come back. Breathe in, and then turn to your right, and breathe out. Give a good stretch, and come back. Well done. Okay, so this is a very good exercises to move your head around. So in medical term, it's called a rotation. So you got to do it 5 times. Okay, 5 times to your left, 5 times to your right. Okay, keep moving. So this can good for, you may actually take picture. Okay, you're allowed to just screenshot, take a picture of this, and you can practice it. Okay, so yeah, you have your phone. Just very quick, 2 seconds, take a picture of it, and then practice it at home or at workplace, or you know, if you're a student studying, also can do. So this stretch can prevent the loss of your, you know, your neck movement as you age up, and which can very interfere in our ability to drive. Why is it driving? Because you gotta look behind ma. Sometimes you just have to look behind. Sometimes you have to look at the side view mirror. Someone honk you, and then you have to just, oh, what happened? Look behind. So this is important in your head turning. Okay, let's move on to the next. We have head nods. So this is, you may allow to take your phone screenshot if you are in your laptop as well. Yeah, just screenshot down, take picture. Okay, so I'm gonna demonstrate it 1 time as well. Look up. Point your chin up to the sky and just point your chin, draw back to the chest. Okay, inhale as you look up, point your chin up to the ceiling, and then exhale, point your chin down to the chest. Let's do it together, everyone. So sit tall, make sure your chest out. Inhale as you point the chin up to the ceiling. You feel a good stretch in front of your neck. And exhale as you point the chin to the chest. One more time. Inhale as you point the chin up. Give a good stretch. And exhale as you draw the chin down. Okay, same thing. You're going to repeat this for 10 times. Okay, this is a very good stretch, good movement, mobility exercises to increase your neck flexibility. Okay, and you know, to reduce if there is any neck pain or unnecessarily tension. Everyone good? Let's move on to the third one, shoulder shrug and release. Okay, so basically this is a relaxation exercise to release, you know, this side, you feel very stressed over this side as well. So what you're gonna do is you sit tall, and I demonstrate 1 time first. Okay, everyone, I demonstrate 1 time, just look at me, don't do it first. You inhale as you shrug your shoulder, bring the shoulder to the ear. So you, and then give a good squeeze. And then as you exhale, you just drop the shoulder down, drop all the weights down. Okay, drop all your stress down, just let it go. So we can do it together. Inhale and shrug up our shoulder, squeeze so tight, and then exhale, just release the shoulder. Let's do it 1 more time. Okay, inhale, bring the shoulder up and give the maximum squeeze, and exhale. Now, breathing is very important. Make sure you inhale with your nose and you exhale with your mouth. When you exhale that time, meaning you let out the air, you just make an O shape like you are blowing a candle. So I demonstrate 1 time here. You inhale, and then you exhale, you go like, okay, so can we repeat last time for the shoulder shrug and release? Inhale, squeeze the shoulder, and exhale, let the shoulder relax down as quickly as you can. Repeat this 5 to 10 times. You may also take a picture of these exercises or screenshot over your laptop. Okay, good. So now continue on. We're going to talk about self-release technique. Whenever you have the discomfort or the strain. So I'm going to quickly tie my hair up here so that you have a good view. Okay, so whenever we have headache, what happens is this muscle group I want to show you all is called a suboccipital group. Never mind, just remember it is right directly below your head. The base, the skull, your skull is this head bone. Now I want you to put your finger like this or your hand like this, and then just directly behind the skull here. Make sure you don't press on the bone. It is very important that you find the muscles, your meat, your muscles, the soft tissue there, that you can apply pressure over it. So very quickly, if you have your lotion, it will be best as well, or medicated oil, just rub around the neck area. And then you put the hand, start to give a bit of pressure, and you slide it down. Okay, I do one more time again. You can also perform with me. Apply a little bit lotion like this around the neck here, directly below the hairline. And then put a knuckle like this, and then slide it down. Okay, and one more time, slide it down. Okay, so you're gonna just push, give a little bit pressure, or you can even do a circular motion to ease out that muscles. That when it is very normal when you press on the muscles, especially when you're having the attack, the headache that time, you do feel the pain, the discomfort sensation. It is perfectly fine. Just do a few more time, and then you will feel that relaxation, that muscles being eased out. Okay. Now the second one, it is usually this group of muscles. If you're having a neck pain, shoulder stiffness over from staring at the laptop for a long time, it is these SCM muscles. So quickly, how to find that muscles? You just gotta turn the head to 45 degrees, and then you draw the chin towards the chest that time, meaning to say you look down. Okay, turn your head 45 degrees and look down. It's a very prominent group here, like a tiang like that. Okay, circular structure. Okay, so cylindrical. Then you gotta just grab it up, pick it up, that muscles. And then when you turn to the right side, you are doing on your left. Okay, turn to the right side, you are doing on the left. And then you are using a left hand. Okay, so you pick up that cylindrical muscles. And then over the thumb area, you just give a good rotation. And then rotate down. So everyone, can you find that muscle with me? Turn your head, turn to the right side, and then just look down. There will be these muscles here. Just grab it up, and then over the thumb area, and then just give some pressure as you go in a circular motion. Okay. Look at how I do it. Circular motion. Just give a gentle, not too hard. Yeah, same apply over to the right side. You turn to the left and you look down, grab the muscles, grab it gently, and just do a circular motion. All right, now let's move on to the last one. It is this upper trapezius. You can also take a picture. Basically, it's the muscles that always tight up a lot of times. So you just gotta grab, you just like a hamburger grab. If you want to do on the left side, use your right hand, and then you grab it up. Okay, and then you just grab it up like that, and then give some pressure. Now the catch here is I want you to do your head movement together. So when you grab it up, give a bit pressure, and you just tilt your head down, and then come back to the center, and then tilt the head down, come back to the center. Very good. Okay, so you are doing on the left side, you are using your right hand. One more time, grab it up. Now I want you to turn your head, turn here, and then come back to the center. All right, and then turn one more time and come back to the center. Okay, and then you release. You feel that all your left side is being eased out. Okay, so these are the three group muscles. Basically, we cover the back, behind the neck, and then there is this diagonal one, lies from behind over to the front side. And then also these muscles, the shrugging muscles group, the one that always tense up a lot. Okay, so we're gonna move on to our final questions is how can you squat or do leg exercises without hurting your knees? So whenever we do a squat, generally people will do, usually most population will do like the left side, knee dominant. So there's two different, either you are doing a knee dominant squat or hip dominant. Very, very simple. If you have a knee pain, don't go for the knee dominant one. and I want to introduce you to do a hip dominant. So how can we do a hip dominant one? Before that, we have to look out is when you squat, do you realize that your squat is turning your knee in? Okay, so you can do a squat in front of the mirror, or you can record yourself in a front view. If your knees are turning in, it's bad. So it usually stresses a lot on the knee joint. So just make sure your knees is pointing out like the picture here. Okay, and how can you do a hip dominant squat? So I want to introduce you all to a technique called the hinge technique, which will help you in your hip dominant squat. So let me demonstrate with you. Usually when I ask you to do a squat, you will go like this. You will tend to bend your knee and then only you like this squat down. Okay, not sure if you can see properly. You usually go like bend your knee and then you sit the body down. So this is not wrong, but you will stresses a lot on your knee. So instead, I would like you to do a hinge. So you can take a chair. Okay, you can take a chair with you. Now just put the leg, touch the chair. Okay, your leg is entirely touch the chair. Now, when I do a squat with the hinge technique, I want you to imagine you just sit down without bending the knee first. Instead of going in front, okay, I want your knee just touching the chair, and then want to sit down, go behind, just like that, and then come up again. Okay, so go behind. This is the hinge technique, and then come up again. So one more time, keeping the leg touching the chair. So it's the calf region here, the behind the knee. Just touch the chair, and then don't go bending your knee, but I want you to sit back by breaking from the hip. So this motion, just practice for me. And eventually, when you go low, once you practice this very well, you hinge it down, then only you start to bend your knee, then it will create less tension over your knee. So look at me. Practice the hinge, and then slowly you bend the knee, go down and up. Okay, and break from the knee, then go down. Yep, that is how you can do a hip dominant squat. So just to emphasize once again, hip dominant squat meaning to say don't break from the knee first. Meaning to say when you do a squat, you tend to bend the knee. Instead, I want you to bend from the hip. Meaning to say break from the hip. Stick the butt behind, like you want to close the door, only can use the butt, and then only you bend your knee. So another good practice is you can take a broomstick at your home. Broomstick, make sure that you're keeping the back straight. The stick gotta touch your head, touch your back, and touch your lower back, your butt here. Just practice. Earphone. Just practice movement like this. Okay? Sit back and up. And sit back. Without your leg move away from the chair. Okay, try to sit back, and then eventually you just bend down, go low. And that is how you do a hip dominant squat. Okay, so I hope that everyone received something today. Very fast, a very quick sharing. Just to recap everything, we have gone through correcting back posture. Start with the forward head. So we can do the chin tuck exercises. Remember, like this, and then like this. And then we also can do the second stretch, the one in the picture here. So you interlock your finger behind, keeping your body straight, and then your chest gonna draw out. Okay? And then lastly, to correct if you have any lower back pain, okay, or you do feel the tension over the lower back, so your exercises can be like, yeah, the one in the sitting chair one. Let me go back up, yeah. Like the one like this, okay. So when you go to this picture is actually when you go down to the mat. You can do like that lah. It's the same thing. We talk about the bone, the pelvic movement, the lower back must be able to have the movement to ease out the muscles tightness or like imbalances over that region. Now moving on to the second questions, how can we reduce neck tightness and shoulder stiffness? We went through 3 different neck movement, the rotation, moving here and there, and then going up and down, and also shrug the shoulder, give the maximum tension and release it. And we also gone through how to self-release your behind the neck over to the side of the neck and also to your shoulder here. Okay, and then the last question we tackle on how to reduce the knee, okay, hurting the knees when you do the squat. Okay, so it's performing, practice this hinging technique. And if you ask me, another great exercise you can do, like this picture over the right side, this lady, this is a Romanian deadlift exercises. You can YouTube it as well, or you can come and ask me personally how you should perform this better. Because when you know how to hinge and you just directly take the weight, slight weight, and then just with a slight knee, the knee bend, just a little bit of the angle. And this is a very, very good exercise to train up your butt muscles and also the lower leg. Okay, so yeah, that is the summary of everything, the 3 questions. So thank you for your time. And yeah, so like just to emphasize again, all these exercises and the techniques is just a general technique. Okay, so if you do feel any pain or discomfort in a certain movement, I would advise you to stop it. Don't go on. Don't just keep pressing on the pain, and make sure that you just find a physiotherapist, or you can just anytime ask me lah. Just this is my number. You can text me as well. You can email me. Okay, to further inquiry anything. Yeah. So yeah, make sure to stay safe and keep moving your body actively so that together we can serve God effectively.